Before I hand over to Drew, I just want to read out a short bio. Drew Sherwin is an optometrist with 10 years of clinical experience. He has worked in a variety of clinical and educational settings across the optical industry and has experience in both regional and metropolitan areas. In addition, Drew has also held several positions with Optometry Queensland and has worked actively to train graduate optometrists. Thanks, Drew. Over to you.
Thank you very much for that intro, Tash. Well, as you've already said, I'm Drew, a clinical optometrist and MD Foundation educator. But just before we get off and running with the topic, as always, we have the big disclaimer to begin. The information I provide today is always general in nature. If you have any specific queries, please contact your eye care professional or whomever takes care of your eye health. The more we get into the nuance of age-related macular degeneration, or AMD, the more that this disclaimer will make sense, because it is a disease that really does have a very wide variety of presentations that a half-hour or hour webinar could truly never get to. But moving on from that one, I want to give you a bit of a rundown of what we're looking at today. Firstly, you'll see this acronym AMD everywhere. And of course, AMD is the shorthand for age-related macular degeneration, because of course that's a bit of a mouthful for me trying to say that 100 times today. So we'll start off going through what is AMD, the various stages of AMD, the symptoms and risk factors associated, as well as the ways to reduce risk and progression. And then I'll summarize with a few takeaways that I hope you all pick up from my presentation today. But very much to begin with, I just wanted to give you a little bit of background and context. Firstly, in terms of prevalence of AMD in Australia. Firstly, we know 1 in 7 over 50s have some stage of AMD, with 1 in 4 patients being undiagnosed. So that is a lot of this condition out there, and more worryingly, a lot of it that we do not know about. And the reality as well is that macular degeneration is the leading cause of blindness in Australia. And of course, there's plenty of it out there that we haven't found yet. So looking at this pie chart, it summarizes the major causes of vision loss and blindness in Australia. And as you'll see, the very large red section corresponds to macular degeneration, representing over 50% of blindness and severe vision loss in the country, equal to all the others combined, including some you may have heard of, namely glaucoma and macular degeneration, which are far less likely to cause blindness than macular degeneration. As with many health conditions, early detection and intervention is critical with AMD, which is why organisations like the Macular Diseases Foundation is here today, and why we're hoping to reduce the impact of macular disease through education and awareness. But before we talk too much about what AMD is, I'd like to start by explaining how the visual system actually works and some of the main structures of the eye. So at the moment, you're seeing a cross-section of the eye, and the best way I can describe the function of an eye is that it's a lot like a traditional film camera. And just like a camera, it relies on letting light into the eye in order to actually create a signal. And that is what the pupil is here for. It is essentially just an aperture, which is on the front of our eye, and it is the little black dot you see in the middle when you look directly at a person's eye. And just like in a camera, this aperture is able to dilate and constrict to control the amount of light that actually enters the eyeball itself. After that, the light then moves through the lens. And this lens is actually capable of changing shape in order to focus the light and make sure that it eventually lands right where it's meant to on the retina at the back here. And the retina is the photosensitive part of the eye, so the part where the light is actually collected and the signal is created. And you'll see a few of the different layers of the retina up the top there peeled back. I'll show you a higher detailed image of that a little later on as well. But from here, once the light's been collected in the retina, it's sent right up to the brain through the optic nerve, which is essentially that protrusion at the back end on the left-hand side of the eyeball you see here. And that is pretty much the most sophisticated electrical cable known to man, known as the optic nerve. And it takes pretty much instantaneously over 100 million units of data from the eye itself right upstairs to the visual cortex, where the brain physically processes the data and creates the world that we all see in front of us. Another important part of the eye is, of course, the macula, and that's what we're going to focus on primarily today. And that is, of course, where the name age-related macular degeneration, or AMD, comes from. The macula is the name of the central region of the eye, which is the green arrow is pointing to in both diagrams. And you'll notice in the second image on the left-hand side, you're seeing it from a different perspective. That perspective is the view that your optometrist would usually have of your eye, looking directly through the pupil to the inside. Now, the macula is actually quite a small structure in truth. It's only about 5.5 millimeters in diameter, so tiny in reality, but it actually is responsible for about 90% of the visual detail we all appreciate in the world. The reason for this is that the macula is responsible for the highly detailed central vision and is essential to tasks like reading, driving, and even detecting colors. In comparison, the outer retina, which is inside that green circle you see, is only responsible for our peripheral vision, and that does all of the viewing outside the central area that the macula accomplishes. So for those of you sitting at home looking at a laptop right now, in essence, your macula is responsible for everything you're seeing in the middle, for seeing myself and the laptop screen right ahead of you, whereas the peripheral vision is doing pretty much everything outside that screen that you're using to look at. So all of your peripheral vision is done by the peripheral retina. So in reality, of course, that is why the macula is so absolutely essential to good vision and to everyday tasks, especially those that involve any level of detail at all. So just to zoom in for a moment, you'll see a much more highlighted and magnified section of the retina with those two specific layers, the blood vessels on the left and the photoreceptors on the right. Naturally, after describing the visual system, it's important to confirm that in age-related macular degeneration, the macula is the area that is exclusively damaged and compromised, and therefore it is only ever the central visual system and the central part of your view that is affected. Over the next few slides, I'm going to go through the different stages of eye disease that can occur, and we'll talk through the different categorizations of AMD, from early right up to the two varieties of late or advanced macular degeneration. But to start off with, I want to talk about the early and intermediate stages, which make up between 80 and 85% of cases in the country, and usually involve either zero or minimal vision loss that is appreciable to the patient. The diagram you can see here is another cross-section of the macula, and we've zoomed right in. And you'll see the two different layers, the blood vessels at the bottom and the photorecepting cells that collect light of the retina at the top. Now, essentially, the blood vessels are designed to support the retina itself by providing it with nutrients and then taking away any waste product that's created by the retinal metabolism. In macular degeneration, there is a breakdown in the removal of these waste products, causing it to build up in the retina. And you can see that there, that drusen or yellow section or yellow part that's almost uneven in shape, wedged between those two layers. This is the first sign of macular degeneration, and in truth, it can be quite subtle to begin with. That's, of course, the reason why regular eye exams are so essential, because in mild cases, and when there's only a few drusen involved, patients very rarely experience any symptoms from their disease. And it's also very difficult for them to judge if there is a significant change. But unfortunately, even though they may not be able to judge any change, there is a very real possibility that there will be progress occurring. So moving on to this slide, you'll see two different photos of the eye, both taken with a retinal camera, which is of course how most optometrists will examine your eyes, and compare them between visits. The one on the left is normal, and purely for our reference, it's a healthy, happy eye. In the second eye on the right, however, you can see those few small yellow flecks across the central region. These are drusen simply from a different view. And this is a very good example of what an early AMD would actually look like to an optometrist. Now, as I move on to an intermediate case, you'll be able to notice some differences in the image on the right. Namely, the drusen will become larger, they are more common, and closer to the central region of the retina as well. Now, the take-home message from these two slides is that even though these changes might appear quite obvious in the photos we have here, these two patients would actually have very few visual symptoms, and it would be very difficult for an individual patient to be able to tell if they had progressed from early AMD to intermediate AMD. And that's something that really does not affect normal life of the vast majority of patients. The only real way to tell if you have either the early or intermediate stage of AMD is if you're seen by an optometrist who's able to view your eye in this way to assess the drusen and any of their potential change, and ultimately monitor your other eye health as well. But moving on from the early changes, I'd like to move on to the first variety of advanced or late stage AMD, which is called dry or atrophic AMD, and it represents roughly 6% of cases in Australia. Dry AMD is a slow form of the disease where changes to the back of the eye happen very gradually. But while the progression of the disease may be slow, there is always progression. Unfortunately, there is no current treatments for this type of eye disease. Now, to look specifically at that image on the right that you can see several large areas of atrophy across the macula, which in reality are areas of damaged or destroyed retina and therefore areas of lost vision. These atrophic areas come about due to gradual changes to individual retinal cells, which accumulate over time to form the larger patches that you can see on this slide. And of course, those areas and patches of atrophy correspond to increasingly large areas of missing vision. A curious thing about this type of the disease, however, is that people with dry AMD experience a hugely differing degree of vision loss, where one person's experience can be drastically different to another's, depending on the location and severity of the atrophy itself. But remember, in all cases, AMD only affects the macula and therefore only affects the central vision. But to move on to the second variety of advanced AMD, which we call wet or neovascular macular degeneration, and it makes up roughly 11% of cases in Australia. Now, the term neovascular literally means new blood vessels, which is what we can see growing in the diagram. Small blood vessels growing from the bottom section with the blood vessels through a drusen and into the retina itself. And ultimately, this is caused by the dysfunction of the visual system and the macular system. New blood vessels are stimulated to grow because the retina is not functioning well and the system is essentially damaged. So it's trying to repair and trying to fix the underlying problem. But unfortunately, these new blood vessels are very weak and much less structurally sound than the large blood vessels you see underneath, which means they can be very easily broken or damaged, which results in blood and other fluid leaking onto the retina itself and damaging the many millions of light-sensitive cells and therefore damaging a patient's vision. This is very clearly demonstrated on our slide here, where we can see a significant pooling and patch of blood and fluid that has leaked out into the macular area and the retina. Now, unlike dry AMD, wet AMD can occur very quickly and will cause a sudden change in vision that is going to be noticeable to the patient. Sometimes this can occur overnight or over a few days as the blood leaks out and starts to cover the retina, as we see in this image here. Fortunately, however, there are some very good treatments available for this type of macular degeneration. But for the best outcomes, treatment needs to be initiated as soon as the leakage and change is detected. The treatment aims to stabilize and maintain the vision. It cannot restore vision that is already lost, because once a singular retinal cell is destroyed, there is nothing we can do to bring it back. That is why there is such urgency in these cases. If you experience a rapid change in vision or a decline in your vision, coming in for treatment on day 2 rather than day 20 can make a really huge difference to the outcome and the effectiveness of the treatments we have for wet macular degeneration. Now, the tricky thing about this type of disease is that even if you're doing the right thing and attending your regular visits with optometrist or ophthalmologist every year, 2 years, or even 6 monthly, a lot can occur between those visits. And unfortunately, it's very common for these changes to occur in between even a 6 monthly visit with your optometrist. And that is why it's so important that patients are vigilant about their vision. I cannot tell you how often I see people who waited a few weeks or even a few months to come in for their regularly scheduled eye test after experiencing visual deterioration. And when they do come in, we can't treat their wet macular degeneration. The damage is already done and the vision is lost. I can't tell you how heartbreaking that is for both of us, really. So the message to take away is that not only are regular visits to your eye health professional important, but you need to be diligent in picking up on any visual changes in between these appointments and then taking action. Don't wait. If your vision has changed, call your optometrist or ophthalmologist and book in. Now, a few notes while we're here. Firstly, the best way to detect sudden and even subtle changes in your vision is by using an Amsler grid. I will discuss that a little later on, and we can tell you how to get your hands on one of those grids as well. Secondly, it's also important to note that wet AMD can occur even if you've been previously diagnosed with dry AMD, or if you've been told that there are only early changes in your eyes. AMD really can be sneaky, which is why we need to be vigilant with our vision. All of that being said, what symptoms would a patient experience with AMD? Now, this slide illustrates the 3 main ones people tend to report, but it's important to note they usually do not tend to be this severe, particularly early on. And there's also a very wide variety of presentations, with one person's experience differing greatly from another person's. But the universal fact remains, it is only ever central vision that will be affected by macular degeneration. Now, to work through this slide specifically, the first symptom is usually difficulty with reading, where text appears blurry, sentences and even letters kind of appear broken up with bits missing, like you notice on this slide. Another symptom is that straight lines can appear bent, warped, distorted, or wavy. A really common scenario is people thinking that all of a sudden their bathroom tiles just look a little bit odd or a little bit bent. Or people go outside and think the telephone pole's all of a sudden on an angle or bent over. Now, let me just tell you, it's very unlikely your telephone pole is actually bent. It's almost certainly your eyes, and you should, of course, report it to your optometrist. Now, the third symptom is that part of your central vision appears missing, blurry, or even black. And people often have difficulty recognizing faces or facial expressions. It doesn't always have to be as severe as you see on the case up here. Some people just describe it as their partner's face looking just subtly off, just that there's something not quite right, just like they're almost painted by Picasso to some degree. So it's not always as severe as it appears. And also, of course, it's entirely possible to have only one of these symptoms or any combination of them. And no changes in vision should ever be dismissed as just getting older. With good health and good specs, your vision should always be excellent. So what are the risk factors for actually developing macular degeneration? Well, the first is age, and it is also one of the strongest associations. As I've mentioned previously, with 1 in 7 people over 50 having been diagnosed, and then from there, the risk does increase with age as well. Another strong factor, and if you have a parent or sibling who's been diagnosed with AMD, there is a 50% chance that you will also develop the condition. Therefore, if you have been diagnosed with any stage of macular degeneration, you should inform your siblings and your kids. Unfortunately, these are two risk factors we can't do much to change. So let's have a look at what we can do to reduce the risk and the likelihood of progression of AMD. Firstly, I've said it before, comprehensive eye exams are a key part of early detection and therefore early action. It's only by going to an eye care professional that you will discover if you have an early stage of AMD. Because as we talked about previously, the earlier stages tend not to produce visual symptoms for patients. Likewise, if you have any risk factors for other eye diseases, such as diabetes, high blood pressure, or a family history of any eye disease, your eye care professional will also monitor you for these changes and conditions in your exam as well. Generally, it's recommended you see your optometrist every 2 years, and your optometrist will let you know if you need to see them more often. If they detect signs of change, you may be asked to come back more frequently. It is also important to note that any changes to your vision should not be considered a normal part of getting older. As soon as you notice a change, you should call your optometrist or ophthalmologist and get in for an exam as soon as you can, because a lot can happen between visits. So remain vigilant, of course. Now, this is the Amsler grid that we were talking about previously. And it's something that is the best way to actually judge change and monitor your vision between regular visits. And it's specifically designed to uncover changes as they actually occur. The grid is a small handheld grid, exactly as you see on the left, with a perfectly printed grid and a small black dot in the middle. We ask you to test your vision by covering one eye and viewing that black dot with the other eye, and just appreciate what that grid looks like. I can assure you that grid is perfectly printed. So if any sections appear wobbly, wavy, missing, or black, that is exactly what we are looking for, and you should make an appointment to see your eye care professional straight away. A sudden change in vision requires urgent attention. Now, if you have been diagnosed with any stage of macular degeneration, you should be doing this test each day. Or if you have one of the risk factors for macular degeneration, we recommend you doing it at about once a week. And remember, of course, this Amsler grid does not replace your regular exam. It's to be used in conjunction with to judge changes between your regular visits. And it's also important to note while we're here as well, that some changes, many changes in fact, particularly in earlier stages, are subtle and much less obvious than you see on the example up on the slide here. We will discuss a little bit later on how you can complete our survey and how we're able to provide you with an example and sample one of these grids. But to move on, I wanted to also talk about healthy lifestyle. And healthy lifestyle is vital to good eye health. Smoking, of course, is a risk factor for developing AMD. If you are currently a smoker, your risk of developing it is 3 to 4 times higher than a non-smoker. You are more likely to develop changes earlier in life and more likely to progress into the late stages of the disease. Cigarettes have also been proven or been shown to interfere with the effectiveness of our treatments for wet AMD. So it's important that if you are someone who smokes, to find a way to quit. It really is never too late. And now the gent you'll see on here as well, and what he is representing, is the importance of maintaining a healthy lifestyle and control your weight through regular exercise. Activities like walking, swimming, Tai Chi, yoga, and even exercise classes run by local community groups are a great way to incorporate regular exercise into your daily routine. And when you are outside, of course, just like this fellow, make sure you're wearing UV protection, sunglasses, and a hat. Now, the next one may seem a little odd, but it is absolutely true. You really should be eating for your eyes, because certain foods have been shown to reduce the risk of AMD and reduce the risk of vision. I'll work through some of the main ones here with you. First and foremost, the group of dark green leafy vegetables. they contain an antioxidant called lutein that some of you may have heard of. Kale, spinach, and silver beet contain the highest concentrations of lutein, and many others, such as Brussels sprouts, lettuce, corn, and even eggs, contain lutein as well, but just in much lower concentrations. Now, if you aren't able to consume enough lutein, or if certain medications mean you cannot eat these vegetables, you can consider a lutein supplement. However, where possible, the natural source is the best, and of course, supplementation is only ever useful if you are not getting enough lutein in your diet. Any excess, of course, is simply excreted. The next one is oily fish, which is known to be high in omega-3 fatty oils. Fish like salmon, anchovies, herring, mackerel, and sardines are great sources of omega-3. The recommendation is to consume these 2 to 3 times per week. Now, interestingly, the supplements for omega-3 have not been shown to have the same health benefits for AMD as the natural products, which is why we strongly recommend you get your omega-3 the natural way. And as well, each week, a handful of raw, preferably unsalted nuts has also been shown to be beneficial for AMD. These include Brazil nuts, cashews, almonds, and pistachios. But of course, a balanced diet should always contain a variety of coloured fruit and vegetables each day. Oranges containing vitamin C is another vitamin key to macular health. And a recent study has shown that eating an orange a day can reduce the risk of AMD onset. And lastly, of course, fatty and oily foods should also be minimized in any healthy diet. By opting for low GI carbohydrates like whole grain breads, cereals, and oats is always recommended over the high GI alternatives such as heavily processed white breads. Overall, these recommendations are important for people who have been diagnosed with AMD or those in a risk group. But truthfully, they're beneficial for everyone and for your overall health and well-being as well. So the bottom line is that a good, healthy, balanced diet is the best defense against AMD. But if necessary, there is another option. There are a group of supplements on the market that follow what is known as the ARENS 2 formula, which is what's shown up here. And these are often marketed to people with AMD. The formula on the slide here shows the different ingredients and their specific concentrations that have been shown to be effective. Interestingly, many of the antioxidants in this formula are derived from those found naturally in the foods we have already discussed. And of course, that is no coincidence. This specific formula was tested in a study known as ARENS 2, which stands for Age-Related Eye Disease Study 2. Nice and simple. The study found that this specific formula was able to reduce the risk of AMD progression by 20 to 25% for people with intermediate AMD in one or both eyes, late AMD in one eye only. Now, it's important to note that the study did not indicate that the formula benefits those without AMD, people with early stages of AMD, or any other combination of the disease that is not specifically mentioned here. Now, unfortunately, to complicate matters further, some products follow the ARENS 2 formula and some products do not. And it can sometimes be very tricky to tell which is which, particularly when you go into the pharmacy and there's just a whole wall of supplements there. So what we do is we strongly recommend you talk to a healthcare professional and get a specific product recommendation for you so that you know that the product you're taking does follow the formula that has been shown to be effective. And of course, finally, remember that a supplement is only helpful if you are deficient in the vitamins and minerals we have discussed and you are not able to acquire them through a healthy and balanced diet. Of course, the big important note as well is that if you're unsure whether supplements are suitable for you, or if you're considering changing your diet, or even need help quitting smoking, it's important to check with your GP, of course. Any big lifestyle or health change should always be done in conjunction with your GP and healthcare professionals. So we've talked about so far what you can do and what AMD truly is, but what treatments are actually available for it? Now, unfortunately, it is only wet or neovascular AMD that has currently available treatments. And these are in the form of ocular or eye injections. And they rely on and use a class of drugs called the anti-VEGFs, which stands for anti-vascular endothelial growth factors. VEGF is an agent that is produced in the eye to promote new blood vessel growth, which is what we saw in the wet or neovascular type of AMD. So naturally, an anti-VEGF drug stops this process and stops new blood vessels from growing into the retina. And therefore, it stops or slows the progression of the disease and the damage that it can cause. Most ophthalmologists run eye injection clinics that often involve undergoing a series of scans of the back of the eye, as well as many vision tests. The eye is then anesthetized, of course, and cleaned to prevent infection before the injection is given through the white part of the eye, typically superior. Thankfully, the injection only lasts for a few seconds. Ophthalmologists will normally do the first 3 injections 1 month apart, and then based on its effectiveness, decide how frequently they are required after that. But some patients, I must warn you, do require injections indefinitely in order to retain their vision. It's also important to note that the really regular and regimented timing of the injections is also very important to the optimal functioning of the medication and maximizing the likelihood that it will stabilize your condition and stop any further progression from occurring. Unfortunately, for all the other stages of macular degeneration, there is no active treatment available. Early diagnosis and maintaining a good, healthy diet and lifestyle is essential to minimizing progression. So I know I've talked a fair bit today and gone through a lot of detail, but these are the main takeaway points I hope to leave you with today. So firstly, please have a regular eye exam with your optometrist or ophthalmologist, and do it as often as they recommend based on your specific condition. Please monitor your vision using an Amsler grid, which we can arrange for you. And remember to report any changes that may occur in your vision to your eye care professional without delay. Time is of the essence with AMD. Also, we strongly recommend that you follow the recommended diet to support your macular health and make sure your body is getting all the vitamins, minerals, and nutrients it needs to function well. And also, of course, please don't smoke and maintain a healthy lifestyle, including regular exercise. Now, of course, we are the Macular Disease Foundation Australia, and as you probably picked up, our goal is to reduce the incidence and impact of macular disease. There's 4 key pillars that we use to try to help and try to make a difference to patients with macular diseases. Firstly, we do presentations like this, of course. So we aim to raise awareness of macular disease and encourage patients to get their eyes tested for early detection. We provide many support services for our patients and also facilitate access to other services where required. It is also our privilege to advocate for the best interests of the macular community, whether it be designing state and federal government policies and practices, or just making sure that medical benefits are not reduced. Finally, we promote research for better health outcomes. Data and surveys informs everything that we do, and we aim to provide an evidence base for our stakeholders and decision makers. And this, as you've seen earlier, is how you can contact us. Please reach out to us on our toll-free helpline number, 1800 111 709, for any inquiries you may have, not just about AMD, but also diabetic eye disease and other macular diseases that we haven't discussed in detail today. We can also help you if you have any questions about My Aged Care or Medicare. And if you have someone who does not speak English as a first language, we can also provide translated material as well. You'll also probably find many of our resources online, which you're able to order for free. Additionally, we also have our macular menu, which has some recipes which focus heavily on the ingredients I've discussed with you earlier that are important for good macular health. And as Tash will talk about in a moment, by completing our survey, we are able to send this out to you and also organise an Amsler grid as well. So I'll pass back over to you, Natasha, and of course, I'll be happy to answer any of the questions that have been coming through during this webinar.
Thanks, Drew. That was fabulous. I'll just keep you on the line. Very quickly before we go to questions, I'll just remind everyone how you can ask a question if there's still something that you wanted to send through to Drew. So remembering just in the right side, there's a dark grey panel. Clicking on this icon will open up the box where you can type in your question, and the last icon, send, is to send it through to us. As Drew mentioned, there will be a post-webinar survey that we'll be sending out. So it's a really good way for us to get feedback on the topics that we're covering, and also getting your advice on any other future topics that you would be interested in. Through completing this survey, you can also receive one of the Amsler grids that Drew discussed as really important in preserving your sight and detecting any changes to vision. You can also sign up to receive the free macular menu or the recipes that Drew discussed, or as well the age-related macular degeneration pamphlet that I have on the screen here. The next webinar that we'll be covering is eye injection costs and rebates. So this will be held on Wednesday, the 30th of June from 2 to 3 p.m. Australian Eastern Standard Time. So one of our educators, Delini Manthalaka from the Macular Disease Foundation, will be presenting this very important topic. If you would like to register, you can do so through the survey link that we'll be sending, or by scanning this QR code. So I'll keep this screen up just if people wanted to subscribe or join up with that code. But now I'll go to some of the questions that have been coming through. Okay, so the first one here for you, Drew. Can early stage AMD be classified as dry, or is that only in the late stage?
Technically speaking, early stage AMD is dry because there is an absence of fluid, but they are two quite different processes. So the dry variety, whilst we separate them out by wet and dry for sort of ease of understanding, it's actually neovascular, which is the new blood vessels, or atrophic, which is what we call the dry. And atrophic actually is where individual cells have been damaged or killed, essentially. And that is quite different to the early stages and even the intermediate stages, where there haven't been any damage or death of any individual retinal cells. There's just the accumulation of drusen that's occurring. So that's sort of the key difference is a dry variety is atrophic with damaged and dead cells, whereas early and intermediate is just the presence of drusen to some degree.
Okay. So if someone's just been diagnosed with early stages of macular degeneration and they don't have any changes to vision, it's more likely that they have the early or the intermediate stage as opposed to dry or the atrophic that you discussed.
Much more likely, yes.
Okay, great.
But you'd find that a quick retinal photograph would be able to tell the answer very quickly at your optometrist's office.
Great. Another relevant question here to the first one. If I have dry AMD, does that mean I will never get wet?
No. You can have dry macular degeneration progress either and worsen in its dry form or change to become wet. It's something, having dry does not preclude wet macular degeneration, unfortunately.
Okay. And can you have both at the same time, both dry, atrophic and wet?
You certainly can. And there's very common cases where patients will often begin with dry macular degeneration in both eyes, and then one eye will change to be wet, whereas the other stays dry, sometimes forever or sometimes for months or years. So you can have even one of each.
So I guess, as you said, really important to be vigilant for any stage of macular degeneration to test on the Amsler grid.
And that's why it's so important to remember to use the Amsler grid individually, so using one eye at a time, because if you do have one eye that is still dry that hasn't changed and one that has, you'll often miss that change as the more dominant eye takes over the workload.
Great, thanks for answering that one. Another question here, how often should I visit an optometrist if I am over 50 and have no AMD diagnosis?
The typical recommendation is every 2 years. That's sort of for a standard patient without any complications. The only potential exception in that circumstance would be if there's a strong family history of either macular degeneration or another eye disease. So my assumption would be 2 years, or a little bit sooner if there's any other risk factors.
Great. A few questions here concerning the injections. So this one that came through is asking, after an eye injection, how long after the injection does it take for the hole caused by the injection to heal?
I'm sorry, Tasha, the audio's just cut out. Could you repeat that?
Yeah, sure. After an eye injection, how long after the injection does it take for the hole caused by the injection to heal?
The hole, it's interesting question. The hole that's sort of formed seals itself almost instantly. Because it's only a very thin needle, it essentially reseals almost immediately after the needle is removed. So there's actually not very much healing that goes on, but it's often only a few days for the surface cells to regrow and fill in that space. So it's not very long at all. And that's why if the eye's cleaned really effectively, there's actually an extremely low infection risk from those injections. It's one of the reasons why they're so effective and very safe.
Great, good answer. Another one here. Should I consider injections to be for the rest of my life? I am 70, wet AMD, well-controlled 3 monthly injections.
I'm sorry, I just missed the first part of that. My internet connection's quite poor. Sorry, Tash.
That's okay. This person's asking, should I consider injections to be for the rest of my life? I am 70, wet AMD, well-controlled 3 monthly injections.
Possibly. You definitely have to talk to your ophthalmologist about that. The factors that are important in that circumstance are how long you've been on the injections, how well controlled it is, and whether any fluid is building up in that 3-month period. Because the purpose of the injections is to dry the macula, to take any of the fluid away. So if you're having an injection every 3 months, and at the end of that 3-month period, fluid is continuing to accumulate in the eye, you will need another injection to remove that fluid. And it's only once that fluid stops recurring that you can stop the injections. And that's the reason why in practice, I don't know in your specific case, but in a number of cases, it is something that is done indefinitely, but because as long as more fluid is accumulating, we need to do more injections.
Great. And I can see there's a few more questions coming through related to injections that people are receiving. So just recognizing we can't answer or give any clinical advice, but as best as possible, Drew will answer the questions coming through. So just one more on the topic of injections, Drew. I had a little bleed after my monthly Eylea injection. Does this result in damage?
Typically, no. The eye itself is actually very vascular, which means that even though the injection site is tiny, every now and then you get unlucky and you hit a really small blood vessel while in the process of giving an injection. Just like if you get an injection, you get a small amount of blood that comes out after that. It's actually no different at all. So it's not an indication of damage. If the bleeding does continue and it doesn't cease, obviously your doctor will want to investigate that further. But every now and then you just get unlucky and they hit a blood vessel in the process. Usually there'll be a drop or so of blood that occurs, no more, and it heals up really quite quickly. But if it's any more than very mild and completely resolves very quickly, you should definitely call your doctor back and let them know about it, but usually the doctors will have seen that occur during the process itself. So they should be aware. And if they're not, please make them aware.
Great. And would you be talking about bleeding at the front of the eye? Because I'm assuming that's what the person meant who asked the question. So bleeding at the site of injection.
Yeah. Correct.
Great.
Yes, that would be sort of a little, it looks almost like a red like pinhead on the white section of your eye, usually at the top. So underneath your upper lid is what it will often look like, and usually red, but no bigger than a pinhead as a general rule.
Great. Thanks for that. Try and do one more question. There's a question here just related to diet. As a vegetarian, where can I get adequate levels of omega-3 fatty acids?
There are there's quite a few options out there, including supplementation. I'd probably say you may be better talking to your GP or a dietitian than myself. Because I'm just not sure about the exact concentrations in a lot of the vegetarian and vegan friendly options. And of course, even if it's got omega-3 in there, you need to make sure you're getting enough. And that's the hard part about it. So I definitely say that's a query for a dietitian to make sure you're getting the right foods with high concentrations so that you are getting enough in the average week.
Great, thank you. We've got a little bit more time, so I'll just try and squeeze in a few more.
Yeah, feel free.
So this person's saying, if my mum had AMD, does that mean that I will have the same stage as her if I am diagnosed as well with macular degeneration?
Probably, but not necessarily. Unfortunately, there's a lot of other factors in there as well. As I think I mentioned, having your mum diagnosed means that you do have a 50% probability of being diagnosed, but there's not actually a very large amount of data correlating the degree and stage of macular degeneration. And a lot of the time, age is a factor as well. For instance, the older we live, the more likely, and the longer we're diagnosed for, the more likely there is to be progression from early to one or both of the advanced stages. So that's something that's often quite variable. If you're diagnosed early and have a very long life, as we all hope to, there's quite a high probability you will progress. But directly between family members, it's very tricky to tell with all the other factors at play.
Great, thank you. Just one more question. I'm not really sure what this person's asking, just the way it's worded. We might try and endeavour to get back to any questions that weren't answered at the end of the webinar. So I think we might leave it there for today. So thank you so much, Drew, for taking the time to take us through that really important topic and going through all the questions with us. I think you explained it really, really well. And it's always nice hearing it from a different perspective and just hearing, you know, a different explanation of, as I said, a really important topic. So thank you so much. And thank you everyone for your attendance and your really engaging questions today.
Thank you for having me.
Okay, bye.